All right. Hello and welcome to our Impact Forum call. Today we will be focusing on mental health and wraparound services for caregivers. And I'm so pleased to welcome Dr. Tracy Neal Walden, the director of the Stephen A. Coen Military Family Clinic at Easter Seals. The clinic provides high-quality, accessible, and integrated behavioral health care to veterans and their families or caregivers, as well as critical wraparound services that make it easier for families to seek treatment in a stress-free environment. And so before we get started, I have to tell you really just how excited I am for this call. And I'm excited because in this job, we get to interact with a lot of caregivers. And I remember about a year ago, we were hosting a focus group for caregivers with one of our partners, and there was one woman who was trying to explain the difficulty she was having accessing mental health support for herself as a caregiver. And she told us how with every therapist she visited, she would end up having to educate the provider on what it means to be a veteran caregiver and why she needed help. And so while, hopefully the therapist was taking away something from that conversation, the caregiver didn't get the help that she needed. And I really think that there's a sense of relief that caregivers feel when they're able to walk in somewhere and not have to, quote unquote, justify themselves to a provider. And so Tracy, what you all are doing at the clinic is just fabulous. And I'm excited to have you on today. And now I'm going to go ahead and stop talking and allow you to introduce yourself, tell everyone a little bit about yourself, and then dive into the great services you provide at the clinic.
Hi everyone. Thank you so much, Laurel, for that introduction. Just a brief overview of who I am, because I want to spend the bulk of my time talking about what we do and how we can be of benefit. I myself I'm a veteran. I'm a retired Air Force psychologist. I served on active duty for 24 years, and I'm a clinical health psychologist. And I mention that because I think that's what helped me really realize how important it is to help the caregiver. As a health psychologist, I've treated clients over the years with various things ranging from cancer to I worked on the burn unit at Brooke Army Medical Hospital as well. And there especially is where I truly saw the need for intervening with the caregiver and the fact that caregivers need that support. You guys are often you're recognized for the great work that you do, but often overlooked in terms of your needs as well. I retired from the Air Force this past summer and came on board here to head the clinic here and to start this clinic. We just opened on 1 September was our soft opening, and then November 2nd was our grand opening here in Silver Spring, Maryland. So that's all I have to say about myself. If folks have questions later, you can ask me more about myself. But I want to, as I mentioned before, I want to talk about our clinic. So just a little bit about who we are. So we're an independent 501c3 nonprofit organization. So we're not in this for the money. We're in this to provide a needed service. Many of you have probably heard of Easter Seals. I think people have heard of it, but they don't really know what it is. They think of Easter Seals as, the little lily emblem and the seals that come in the mail with mailing labels. But no, it's far more than that. It was started in 1919 by a gentleman whose son was injured in a streetcar accident and unfortunately later died. But he was looking into options for care for his son and found out that the options were just horrendous, residential facilities. And so he realized that there was a need for doing more for individuals with physical, mental, and emotional issues. So Easter Seals has been doing that since 1919, but what we did in 2017 is formed a partnership with the Coen Veterans Network to provide on-site mental health services in order to expand the services that Easter Seals provides. So next slide. This slide here just gives you a snapshot of where the Coen Veterans Network is currently and where we're going over the next year. All of the organizations are nonprofits. We're funded by Mr. Stephen A. Coen, who his son was a Marine, and his son came back from deployment and told his dad, "Dad, this is where you need to invest your money." His fellow Marine reservists were unable to get the care that they needed, and so his dad looked into it and started putting his money into clinics, with the first clinic opening in New York City. So as you can see, there are clinics across the nation, and the plan is to have 25 by the year 2020. So what do we do in these clinics? Laurel shared with you the first line, but one thing that I want to change or tweak a little bit in that first line is that it states that we provide high quality, accessible, and integrated behavioral health care to veterans and their families. And it says or caregivers. That should not be an or. And I made these slides, but as you know, whenever you put slides together, you later find something that should be changed. That should state and caregivers. Caregivers are not an or and are not an afterthought. It's incredibly important to include the caregiver as part of the client's care, and or the caregiver themselves may be the client. They may need some additional services. Who we treat, we'll see anyone who has a military affiliation. So veterans, including Guard and Reserve. We focus primarily on post 9/11 veterans, but we're not turning anyone away. Right now, we have the capacity to see any veteran from any era and or their family members or caregivers and caregivers. If there's a need that exceeds our capability, we will then assist in getting them to the right level of care. But we don't turn our back on them. We have case management here in order to help those individuals. And then two important things that I want to point out is that our services are no cost. In the future, we plan on doing TRICARE reimbursement. And of course, with TRICARE, there's a copay. However, if an individual is unable to pay the copay, we will not pursue that copay. The goal here is to give individuals the care they need, not to chase a copay. Lastly, I'll mention on this slide that services are provided regardless of the veteran's discharge classification. All right, so let's go into what we do, and this is what I'm really proud of in terms of the flexibility and the types of appointments that we do. So we'll see individuals for individual counseling, couples counseling. We see children. We do family therapy. As I mentioned a few moments ago, we have a case manager on staff. I get really excited with that next bullet, telehealth. Telehealth, we're rolling out telehealth. We're on track to roll it out on May 1st. And what that will allow us to do is to reach those clients who it's not easy for them to get into our location. If they live, perhaps they live in Hagerstown, or some individuals live a little bit further out in Virginia, perhaps Manassas, and that may be difficult especially if they're a caregiver, they may not have that flexibility. And so this will allow us to provide therapy in an individual's home. So I'm very excited about that. Medication management, we currently do not have a prescriber on staff, but we're actively recruiting for one. And I mention that here so that if any of you are aware of any psychiatrists or nurse practitioners who are looking for a job and want to help veterans and caregivers and military families, please send them our way. We also do peer-to-peer support groups, and we're working with the Yellow Ribbon Fund to host support groups for their caregivers in our clinic. And this is one of the things that, and that actually does not require an appointment. That's just a service that we're going to provide a set day and a set time. And that's something that we do a lot. We look for partnerships in the community to see how we can better serve our community, especially our military community. Then we also offer skill building workshops and groups such as stress management and parenting classes. Our therapies are evidence-based, and what I'll say with this is that some of you may have heard of these types of therapies. The key here is that we want to provide those services that we know work, that the evidence shows works, especially with our wounded warriors who may have PTSD, depression, or anxiety. We know that these therapies have been found to be highly effective in reducing symptoms as well as maintaining those goals. All of our clinicians are trained in these therapies, and all of our clinicians are culturally competent in working with military clients. 50% of my staff are veterans themselves. Next slide. So what we treat, and this is just a snapshot of what we treat. You'll see the photo here is actually one of our clinical offices. This is actually our case manager's office. So, and as we go through the presentation, you'll see a few photos of our clinic, and we really, our goal is to make it warm and inviting for all of our beneficiaries, so that it's a place where they feel welcome, they feel comfortable. It's an opportunity for them to come, relax a bit, and get their needs met. This is a snapshot of the primary presenting issues that we're seeing in the clinic. However, it's important to note that we work with all of our clients, whether it's a veteran, a family member, or a caregiver, to work together to identify that chief complaint, so that we're not just deciding what we think you need to work on, but it's something that you're really invested on improving. One of the things that I think is really important here, and this goes back to who we are in terms of that partnership between the Coen Veterans Network, which does mental health care, and Easter Seals. What's so great about the marriage that we have is that we're able to have a great network and ecosystem of services. And so these are the services that we also have here in the same building that we're in. And I'll just briefly go over them on this slide, and then I'll provide a little bit more depth in the other slides. But what's important here is that this allows us to do warm handoffs to our other programs and other services within Easter Seals. And it allows us to focus on the whole person and that whole family. You can go to the next one, Laurel. So the first one is Military Respite Program. This program provides both in-home as well as a monthly in-center event for children with disabilities and their siblings. And what's really great about that is that oftentimes Events are focused on the individual with the special need, or with the mental health concern, or with the physical health concern. But with our monthly event, we invite in the sibling who may or may not have a special need, and they are able to be celebrated and have a great time. And then it gives the parents and or the caregiver the opportunity to have some time off in order to focus on themselves. Again, what's great about this is that for those in clinic or in center events, our clinic is open during those times as well. And so the parents could come upstairs for a parenting class, or they could come upstairs for just their own individual or couples therapy, or they could just go down the street and have lunch, whatever works for them and whatever meets their needs. Next. Our Little Warriors program is another program that we offer here at Easter Seals. And this was based on a need that was seen within the community. Actually, the former commander at Walter Reed saw this need as he saw our wounded warriors coming through Walter Reed for their medical care. The older children would be in school, the younger children would be following along with their parent or parents and a caregiver. And so it was very obvious that something else was needed for these children. And so we have a child development center here on site, and those children are allowed to come here, and they actually receive a scholarship for that care so that they can get back to a normal routine, or as normal as possible, the new normal, with their peers, and then their parent can get their medical needs taken care of, and their caregiver can focus on the parent who's getting the medical needs taken care of. We also offer adult day services, and these services are for individuals with both physical and or intellectual disabilities. I want to mention that because with our wounded warriors who have TBI, oftentimes they need something else in order for the caregiver to have some time to themselves or to feel productive. And so within our adult day services program, they do art therapy. It's an intergenerational center, and so those who are able to, they read to the children who attend the child care center, or they may do art therapy with the children. They do Zumba, they do music therapy, just a lot of various events in order to have a productive day. And this program has been highly effective in terms of keeping individuals out of nursing homes. So we're very proud of this service. We also offer a veteran staffing network. This veteran staffing network is a full service staffing agency. So they recruit for positions, they assist veterans and family members in finding jobs, and so they'll place veterans and military spouses. They even do employment coaching. So some individuals might not quite be ready for employment, and so they'll work with them to get them to where they need to be. And what we're really pleased with this program is, I mentioned those warm handoffs. Oftentimes with this program, as individuals transition out of the military or move to this area and a spouse may need employment, they may be just dealing with various stressors. And so because the Veteran Staffing Network is on the second floor of our building, we're on the third floor, we frequently do warm handoffs between our clinic and VSN and vice versa to ensure that everyone's needs are met. What's really great about this program is that most staffing agencies charge the member. There's no charge to the member. this staffing agency is able to stay in business by collecting revenues from the organization which hires the individual. And then they use all of those placement fees and reinvest it back into our programs. And I'm pleased to say that the Veteran Staffing Network actually found me as I was at home recovering from foot surgery, about to retire from the Air Force, and they found me on LinkedIn. So I feel like I'm a success story from the Veteran Staffing Network as well. So a brief summary here, and then I'm going to show you some more about some of the other spaces in our clinic, and then we'll have opportunity to go through your questions. So some things that I really want to focus on here, I've talked to you about all of the services that we offer, but I want to hone in a little bit more in terms of how this affects the caregiver. When you think about mental health care, oftentimes that's focused on that wounded warrior. I mentioned to you all that I worked previously at Brooke Army Medical Center, and my job was to go in and meet with the soldier, sailor, airman, or Marine who had just come back from Afghanistan or Iraq and had suffered significant burns. But what I quickly found out after meeting with a few of those individuals was that, oftentimes it was the person sitting in the chair next to their bedside that really needed the assistance. And so it's about focusing and looking at how we can better help the whole family, because by caring for that caregiver, that's going to increase the effectiveness of the wounded warrior's success and their improvement in their life. And so we do this through all of these services. Each of these services are able to not only assist the wounded warrior, but to touch the life of the caregiver. And some of the other ways that I want to mention that we do this is within our clinic. I mentioned the different therapies that we provide, but we also, and we have a child care center here, but we also provide child care in the clinic. So if an individual is coming in for therapy and they need child care, we'll provide that during the time that they're here for their therapy. And it's all about breaking down those barriers to care. So we want to meet an individual where they are and look at what are the needs that they have and how can we address them in order to make the individual successful, in order to make the caregiver a better caregiver, and so that caregiver does not end up suffering from caregiver stress or caregiver burnout or compassion fatigue. Next. These are some of our friendly spaces within the clinic. We really, really worked hard to make the clinic warm and inviting. And so when you enter into our reception area, there's the regular reception area for our adult clients, but then we have an area for our children as well. So on the left is in our reception area, and then the photo on the right shows our playroom. And this is the room that our children utilize when they're here for childcare. But we also have a one-way mirror in order to do children's therapy sessions too. And so this is one of the rooms that we use for parent-child interactive therapy in order to help parents learn better ways of interacting with their children in order to improve behaviors. Again, meeting the needs of our clients and our caregivers. We do this with flexible hours. And so we have early hours. A lot of mental health clinics, non-military mental health clinics, are 9 to 5. We're open until 6 most days, 8 on Wednesdays, and then we're open 2 Saturdays a month. These are the hours that are currently working for us and our clients. However, we're flexible, and we know that as we continue to grow, our hours may need to grow, and we're willing to step up to that challenge and do that. This slide just shows you our location, the phone number for our clinic, as well as our email address and our website. I encourage you all to go to our website, as well as our Facebook and our Twitter, to see some of the great things that we're doing throughout the community. I think during this brief presentation, I'm only sharing a small snapshot of what we've been able to do and what we will continue to do to really meet the needs of all of our beneficiaries, including those caregivers.
Wow, thank you so much, Tracy. That was fantastic, and I'm really excited to see all of the great work that you're doing in such a short time, too. You guys didn't open very long ago, and so, I think it's really great that you have been able to build these services in so quickly. At this time, we will open it up to all of you on the phone and on the computer for any questions that you have. Just a reminder, you can use the chat feature to pose your question, or you can use the Q&A box as well. And I'd like to start off with a question that you sort of touched on, Tracy, but I think, I would love to hear more about this. And that is, why was it important to you and to the Coen Veterans Network to care for the whole family, including, but including the caregiver from the very beginning? Why did you choose that model?
Yeah, that's a great question, Laurel. Well, research shows that including the whole family, including that caregiver, it significantly enhances the effectiveness of treatment by reducing symptoms for the whomever that client is, and maintaining those gains. And this can be done in numerous ways. Oftentimes, if it's the caregiver who's coming in, and if they're getting treatment to feel better about themselves and to better cope with things that are going on in their lives, the research has shown that then they're able to be a better caregiver. And then on the flip side of that, even if the caregiver themselves is not getting therapy, we encourage them to come into the clinic to, at a minimum, to be a collateral in terms of providing additional information to help us get the whole picture of the individuals that we're treating, as well as for us to share with them, with, of course, the client's consent, share with them what our treatment plan is and how they can be an integral part of that treatment plan. And again, research has shown that it's been highly effective in decreasing symptoms and maintaining gains. And so I talked about evidence-based therapy, and this is part of evidence-based therapy, doing what's right for the client and the caregiver, even if they're the client.
Absolutely. Yeah. And I love just personally the idea of treating the caregiver as that individual as well, with their own distinct needs and supporting them in those. We have a question from Centerstone Military Services. How are you all defining wounded warriors? Is this only physical? Do they need to be receiving benefits from the VA to use your services?
That's what's really great about this network and why I love working here so much. Wounded warrior is based on how the individual defines it. It's the same thing for family. It's based on how the individual defines family. So for us, our bottom line is, as long as someone is affiliated with the military, as long as they have been a veteran, it does not matter what type of discharge they have. The wounded warrior piece is based on how they define it. So that part really does not, it's not significant for us. The most significant thing is getting them in. So we don't have a narrow definition.
That's great. That's wonderful. Before we continue with more questions, I'd like to take a moment and just say that the questions you're seeing on the screen, as we do for every call, these are questions for you as an organization. So all of you listening in, and hopefully, they start to prompt some thinking. If you don't already serve caregivers, how can you be serving them, or how can you be starting to recognize them as individuals as well? And if you have any questions, please keep sending them in as well. Is this a program that Easter Seals would consider partnering with an organization that has space, resources, and capacity to bring this program to their location? So I think this question is asking, if I may, if there's an organization that has the location and space available, would Easter Seals or the Coen Veterans Network partner with them there as well?
Absolutely. That's one of the, I talked about some of the ways that we're looking at some of the things that we're doing in order to reach our clients, such as telehealth. But one of the things that I did not mention is that we are considering satellite locations as well. And so if there's an organization that has a space and they see a number of veterans or caregivers of veterans, then we would definitely entertain that idea and would love to explore that opportunity some more.
Excellent. And then how do families find you? Through VA referrals, community referrals? How do they get to your doors?
Yeah, all of the above. We have such great partnerships, and I have a great outreach team, which is wonderful. We get referrals from the VA. We get referrals from the military medical treatment facilities in the area. We get walk-ins. Folks see the advertisement. We have the advertisement on the metro, so the local trains in the area. People call, people email. You do not need a referral, but we do get referrals from various sources.
That's great. And then I think too, this is another way, right? All of the folks on the call, if you have clients you think would benefit from this service, please let them know. So it sounds like community collaboration is really key to your success. You mentioned working with the Yellow Ribbon Fund and of course the VA. So can you talk about the process by which you establish those collaborations, and how can the people on the call or people in the future partner with a clinic in their area?
Yes, so as I mentioned, I have an outreach team, and our outreach team, they're out on a daily basis meeting with different organizations, and they're active within the community. So they're part of the Montgomery County Community Collaborative, the Fairfax County Community Collaborative, the DC Mayor's Office. So because of our location, we really have to push out to Virginia, Maryland, and DC to ensure that we're reaching the individuals who need our services. And that's how we've actually found some of the other organizations who wish to partner with us. But then other times it's just been, the team or even myself out at an event, and I'll just start chatting with someone or they'll start chatting with someone, and we realize that there's that mutual need where we could help each other. We even have the Veterans Consortium, which is a pro bono legal organization. They come to our clinic. They were here yesterday, and they'll work with clients on discharge upgrades or any other legal issues. It doesn't even have to be a military-related legal issue. And they do this for free. They were in the clinic just yesterday and assisted 27 veterans and family members for free.
That's great. That's
Yeah.
amazing. Okay, the next one is a two-part question, sort of, and you've talked a lot about how the services you provide both help caregivers directly and also help them indirectly by servicing their veteran. And so I think this next question is trying to get at how do you use the caregiver's wealth of knowledge, to your advantage and to bring them into the care team for the veteran. And so I'll read the question directly, but do caregivers accompany veterans to their visits commonly? And if so, has it been easy to make sure that the providers integrate the caregiver into the team or take advantage of the caregiver's expertise? And she says, thank you, inspiring work.
Well, thank you for the question. It's a great question. And yes, caregivers frequently accompany the client to their appointments, and they are brought in as part of a collateral within the appointment. We use an electronic health record system, and what's so great about, and it's just internal to us, so the information doesn't go to the VA or anyone else, but we're able to put that collateral information into the system. It's established with the expectation that that's just normal to get additional information from someone else in order to get the whole picture. So we'll bring in that caregiver to work with the client and the clinician on establishing the treatment plan, on assisting the veteran in adhering to the treatment plan, and to really just find out what some of those other barriers are that may be hindering an individual's or may negatively impact an individual's ability to improve, and so that we can then problem solve that as a team together to meet the needs of that individual.
That's great. That's an important part that the Dole Foundation is trying to work towards as well, is how can providers, really use the caregiver support to their advantage and make sure that they build up the relationship with the caregiver as well as, their direct patient. When the relationship is good, it's really good and it's really beneficial, I think, to the provider. So I'm glad to hear that you guys are able to make that connection with them. Another question for you. Can you please talk a little bit more about telehealth? Can a client who lives in another state be provided services through the telehealth at your clinic or another one?
Yes. So telehealth, as I mentioned, we're rolling it out in May. Our clinics, the Coen Veteran Network clinics that are in Texas, are already utilizing telehealth throughout the state of Texas. I'm not sure if they're providing it in other states, but for us, we will be providing telehealth to individuals who live in Virginia, Maryland, and DC. And I should point out there's some little barriers to do that because it's required our clinicians to be licensed in each of those states in the District of Columbia. And so we've done that in order to provide what we feel like is a very important service, and it will just really increase access to care and break down a barrier, which can be transportation, or it can just be the physical issues that someone may be dealing with may make it too difficult for them to leave the house to come to appointments.
Absolutely. That's all good to know. Thank you. I have another two-part question, so I'm going to ask the first part first and let you answer, and then I'll ask the second part. This person is not sure if they missed this part of the presentation, but can you speak to your engagement with the DoD and VA caregiver program policy offices to address needs not available through the agency's programs and services? So how do you work within the DoD and the VA, both, I think, from a veteran perspective, but then also specifically with those caregiver programs?
So we're actively working with the Department of Defense and the VA. Right now, we're specifically working with POC, the military treatment facilities, and the VA. We don't have, I think this is one area that we can improve upon in order to work more specifically with the caregiver organizations. And hopefully, as a result of this talk, it may help to build better relationships there, because we're definitely open to it. It's about finding the right POC in the right office. But for now, we're primarily working through representatives in the military treatment facilities in order to refer us the cases and to point us in the right direction in terms of where the need is and who we should be interacting with. But if anyone has any other suggestions for how we can penetrate that better, or who else it would be of benefit for us to network with, please feel free to reach out and let me know, or let me know now as well.
That's great. And then the second part of that question is, do you work with FRCs, Federal Recovery Coordinators, as well as both at DoD while in service and post-service in VA? So do you work with those folks?
We've not worked with them, but that does not mean that we will not. I think it's just an area that we have not explored yet, but I'm writing that down right now so that we can start working on that immediately.
Yes, that's a great suggestion. Thank you, Renee, for that. You touched on this a little bit, but I'd love to explore a little bit more. You keep mentioning evidence-based therapies and everything. What other research or what did you draw from when building up your programs? And I'm thinking specifically caregivers, but also, you know, any other studies that you may have used or data that you pulled from to build out this program.
Yeah, so to build the program, we looked at various things. Number one, we were, and not in terms of importance, just in terms of my thinking, number one, we wanted to look at what were those barriers to care. So access to care. Access to care is a huge barrier, especially for caregivers. Who the caregiver may be a military beneficiary, they may not be. And if they are, then they're likely to be referred out to a network, and then they have to kind of navigate that and figure out who the best person is to see, and that person may not have the best skills and may not be doing evidence-based therapy, or may not have flexible hours. So we really wanted to look at breaking down those barriers to access to care. And then I mentioned for caregivers who are not a military beneficiary, then they wouldn't qualify for services within the Department of Defense, and definitely not with the VA. And so our goal was really to look at what are those services, and this is what the Coen Veterans Network did in starting out. They looked at what services are the DoD and the VA currently offering, and then how can we complement those services? And so where is the true need? And that's where we really want to come in terms of meeting that true additional need. So we looked at access to care. We also looked at, in terms of deciding who we would serve, why are we going to serve them? And if you think about caregivers, the research shows that caregivers they're often recognized, but they're often overlooked in terms of their own needs and or the benefit that they can bring by incorporating them into therapy. There have been studies done that have shown that caregivers, more than 50%, may have symptoms of depression at any one time. And if those symptoms go untreated, about 25% of them end up meeting criteria for depression, for diagnosable depression. So when you think about that, and this is someone who's taking care of someone else, it's just really, it's incredibly vital that we meet that need in order to better help the caregiver to take care of the veteran and the wounded warrior. And so we looked at the research on that. And we looked at the research on caregiver burnout, as well as compassion fatigue. And there was just such strong evidence that this was an area that we really needed to focus on, and that's why we're doing it.
Absolutely. Yeah. And you know, research, I think for those of you listening who have stuck with us for all of our impact forum calls so far, research is always a theme throughout. And it's just really important to us to, you know, feature organizations who take that seriously, because it's one thing to hear about it anecdotally, and it's another to know that there's a trend and know that you can make an impact in a certain way. So I want to open it up just to a few more questions, and then I'd like to end on one final one. So if you do have any further questions, please feel free to ask them now, and we'll close out, I think, probably a little bit early too. So one more from the group. You mentioned that your providers are military culturally competent. How do you know that they are? How do you test for that or train for that?
Yeah, great question. We actually have required training for them all. It's a training that was developed by the VA, and again, we really value those partnerships, and it's on all of the services. So learning about all of the services, it's pretty intensive training. So our folks do it within their first 2 weeks of employment when they're, when we're still in the onboarding process. It's computer-based training, but it's not death by PowerPoint. It's very interactive, and frankly, it's really good. I told you that I was on active duty for 24 years, and I worked at various joint bases, so I really thought that I knew my stuff about, all of the services, and there were some things that I did not know, and I actually had to go back over a few of the components in order to pass the test. So there are knowledge-based tests throughout the training as well.
Fabulous. That's really good to hear. And that was a great question. Thank you to whoever submitted that. Okay, I want to close with a final question, and we'll see if we get any more viewer questions in. But this goes to what I think we at the foundation consider the biggest, not problem, but challenge perhaps is a better word for it. And that's recognizing a caregiver when you see one, and helping them to identify as a caregiver so that they can access the support that they need. So I would love to hear, just as sort of a closing message that speaks to some of these questions that we see on our screen right now. Tracy, what advice do you have for organizations on how to recognize a caregiver, and then how to treat them and seamlessly bring them into the services?
And by recognize, you mean identify?
Yes.
Okay. That starts from the very beginning. So most of our clients come to us via telephone, and we do a pretty lengthy telephone screening with them. During that process, we find out, typically most clinics will ask about, are you married? Are you single? We go into far more depth than that. And so that's one of the ways that we identify a caregiver. We want to know who else is living in the home, who else is part of their, life. If they have an injury, whether it's physical or mental or emotional, we want to find out, and we do find out, who else is assisting them in their daily life. And so it's really about asking additional targeted questions to really get an in-depth assessment of what the individual is going through and what their true needs are. And that's, for us, that's how we found some of the individuals who we've identified as caregivers, because oftentimes they would not have identified themselves as a caregiver, because many times an individual thinks that they have to be, on paper identified as a caregiver, where it may be someone who's taking care of someone every day. They're not getting any sort of reimbursement, and they may not even be a family member, but they're spending 8+ hours of their day assisting an individual, and that's a caregiver. And that's the type of information that we find out, and we encourage them to come in as part of the care. There have been a few instances in which someone else has just been in the waiting room with someone, and so we'll just chat them up. Our staff is very warm and friendly and engaging, and they'll just start talking to the person while the individual may be in our lobby having a cup of coffee. And that's how we find out more information also.
Fantastic. So really, I think what I'm hearing from this is being mindful of the person who is accompanying the veteran, being mindful of the people in the room, and then just being a little bit more thoughtful and intentional about how you ask people questions.
Yes.
Wonderful.
Absolutely.
Well, thank you so much, Tracy, for joining us. If anybody has any questions or would like to get in touch with Tracy or her team, please send me an email. I will be posting the recording of this video as well as a key takeaways document in about a week's time. Don't hold me to that, please, but I will try. And again, thank you so much, Dr. Neil Walden, for being with us today. We really appreciate all of your insight and thoughts on mental health support and wraparound services for caregivers.
Thank you for having me, and thank you for the wonderful questions from the audience.
Of course. All right.